although we're not practicing crisis standards of care medicine on this side of the state, we still feel like we're in crisis.
Earlier today, hospital leaders from across the state spoke about the current COVID-19 crisis in Washington. Local hospitals have continued to cancel non-emergency surgeries as hospitalization numbers remain sky high.
So this comes as Governor Jay Inslee asked the federal government for additional resources to help our local hospitals. Our Ian Smay is joining us now live from the newsroom with more on what health leaders had to say today. Ian.
Mark Whitney, Providence's Chief Medical Officer, Dr. Dan Getz, painted a bleak picture of the current COVID surge in our local hospitals. While we aren't in crisis standards of care, surgeries to help people manage pain are still being delayed as hospitals are pushed to the limit with COVID patients. All of this has led Governor Jay Inslee to ask the federal government for help.
COVID-19 hospitalization rates have fallen slightly in Washington since last week. Doctors say the good news is that more people are getting vaccinated, but there's also bad news.
The reason it is not good news is that one of the reasons the hospitalization rates are falling is that death rates are rising. And so that is a reason when you've got fewer people in the hospital is because some have died.
Here in Spokane, hospitals are still feeling the strain. Providence's Chief Medical Officer, Dr. Dan Getz, says even though hospitalization started to plateau over the weekend, his doctors and nurses are still very busy treating a high number of COVID-19 patients. Getz did emphasize that Providence still has the capacity to treat those needing emergency care for now, but he says they need help from the community for that to continue.
It's challenging. We really do need the help of the community to get vaccinated, wear masks, because we're tight. And I don't know if we can continue to care for more and more patients in our community. But it really is an issue related to vaccination and mask wear.
Healthcare workers are converting new areas to treat COVID patients, and hospitals have to staff those areas. While Providence can still provide emergency care, non-emergency surgeries are still being delayed. Getz says just because a procedure isn't considered an emergency doesn't mean it's not important.
Lots of spine surgeries where people are in constant pain. They're not sleeping, they're in agony, and we can fix that. We can provide comfort, and we're having to pause that.
The current COVID-19 situation has led Governor Jay Inslee to ask the federal government for help. Much like what's happening in North Idaho, Inslee is asking for medical staffing and resources. In a letter to White House COVID-19 response coordinator Jeffrey Zients, Inslee asked for medical personnel from the Department of Defense in addition to 1,200 staff members that the Department of Health has already requested from the federal government.
Dr. Getz made it clear today that healthcare workers would never withhold care from someone based on their vaccination status. He did also say that most COVID-19 patients are unvaccinated, and almost everyone who needs a ventilator is also unvaccinated. In the newsroom tonight, Ian Smay, KREM 2 News.
Ian, thank you very much.